In this note, we are going to discuss few tools that we need when we care of the patient, particularly for prioritizations. Out of 4 patients, who will you have to visit first? So first of all, when a patient comes to you, you follow ABC law. A stand for airway, B stand for breathing, and C stand for circulation. So remember to establish a patient airway for your client. So if patient airway is blockage or any secretion, we need to suction and we need to clear it first. And then be sure the client is breathing well. If any obstacle, we will remove it and check to see if the client has a good circulation. If patient has an active bleeding, we will stop it first. If patient has blood pressure down, hypotension, and hypotension lead to the shock. So my patient need the IV saline solution. Patient came because of the burn and patient need fluid replacement lactate ringer solution. So circulation is important. Means you have to check the vital sign, blood pressure, pulse rate. Also, do not wait until there is a crisis to assess for ABC. So you need few seconds to check the airway, to check the breathing, to check active bleeding, circulation, vital sign, or any other disabilities. Or you have to remove the patient from any kind of danger. And next tools here, therapeutic communications. So when you deal with the patient, you could ask the question, leading question, to find out what is your patient diagnosis. And you will talk the way that would be easy to convey the message to the patient. So sender or receiver would be effective. So therapeutic communication is very important. So remember to utilize therapeutic communications. Choose the response that allow the client to express his needs, fear, or concern. But mental health questions may be handled differently. So how you deal with any patient except the mental health, it would be a little bit different. For example, if the RN suspects suicide is an issue for his or her client, then direct questions is required. So if patient have a history of suicidal attempt, it maybe again will take the steps for suicide. As a RN, we always make sure someone always with the patient. One-to-one observation is important. Safety is the first priorities. And do not feel like you want to hurt yourself. So you can ask the question. So have you taken any steps for suicide? Or do you feel like you want to hurt yourself? If the answer is yes, means it is danger, needed extra care. So in mental health cases, also reality-oriented may also be called for. So when you deal with the mental health patient, it is good not to go for argument or debate with them. And also your eye-to-eye contact, your body language, your movement, all is important and all is the part of therapeutic communications. Next tools here talking about expected and unexpected. So what are the disease outcome or sign and symptom? If you inform your patient before, your patient will be aware about this. They will be concerned, but if they know, it would be easy for them with adaptation. Whatever it is, here talking about the questions and answer. So determine what the stem of questions is asking. So a question and there are 4 options. So out of 4, if the 3 is similar meaning, one is opposite, that should be the answer. So they said if the 3 of 4 choices given are correct or are expected findings, then you should choose unexpected findings. That is answer. Number 3, they said if 3 of 4 choices give are incorrect or are unexpected findings, then you should choose expected findings. Let me explain one more time. Number 2, they said out of 3 of the 4 choice, like out of 4, the 3 is positive, 1 is negative. Negative 1 is answered. Here they said out of 4, the 3 are negative, and only 1 is a positive. That one is the answer. So next go the time management. So the client most recently admitted is not always seen first. So it is depends the need, the priorities, and also the ABC laws or Maslow's law. Now remember the safety. So safety is the first priorities. So check the client first, then the equipment. So like a patient under chest tube or tracheostomy tube. So if any abnormalities occur or reading is not normal, we always check the client first, then we will check the equipments. Next tools here about the Oram theory of nursing. So the nurse must be concerned with the following, according to the Oram theories. Oram theory, it is the self-care deficit theory. So the Dorothy Oram's self-care deficit theories describe the nursing as the act of helping others within the provisions and management of self-care to take care of or improve the human working at the house level of effectiveness. So, first of all, universal healthcare needs. First of all, air, water, food, eliminations, rest, socializations, and safety or hazard. So air include oxygen, airway, and temperature. Water means like a patient has a COPD or acute exacerbation of chronic bronchial asthma. They need oxygen, right? It is the need. A dehydrated person need water for rehydration, or excess water can cause food volume overload. So The Oram theory is useful in nursing practice. Like, if any vitamin or food deficiency, patient develop malnutrition, feeding constant. Also, we need to eliminate the urine and stool. So proper evacuation of bladder or bowel is important. Also, after all of this, we need the rest, enough sleep, comfortness, freedom from pain, and socializations, the right balance of solitude and social interaction must be needed. And finally, hazard. Safety must be provided for. So, Oram theories of nursing was selected for the this assignment as it can be applied the most of the practice setting. Hmm? So next here, talking about the disaster nursing and triage. So here, the triage we categorized priority 1, 2, 3, and 4. So first of all, let me tell about the what is disaster nursing. So disaster nursing can be defined as the adaptation of professional nursing knowledge, skill, and attitude in recognizing and meeting the nursing or health and emotional need of disaster environment or situations. So when we deal with the patient, you go for the assessment and you have to find out who need the help first, or the triage nurses require the advanced clinical decision making skill, or they will be expertise in clinical setting. So basically the triage nurse, they need to make a complex decision, clinical decision, or in condition of uncertainty with limited or obscure obsession or obscure informations, also with minimal time. What does it mean? Imagine suddenly tornado occur in Florida, or suddenly flood in Texas. So in that situation, we have a limited resources, we have a, so many obstacle of informations, we have a minimal time and uncertainties. So in that condition, the nurse have to have the power of decision making, right? So make complex clinical decisions. So like a patient need little bit help and they will be okay. Another patient is really bad. If you give maximum time, although the chance of survive is very low. So which patient you go first? Who need minimal help and mix, and patient will be okay, and this patient can help you to manage the other patient. So have the limited margin of error. So within a short time, if you do something wrong, it will be more worse. So always be able to rapidly identify the problem and respond to actual life-threatening state. Also be able to make a judgment on potential for life-threatening deteriorations. Let me read it. So priority one, we call it is red, means they need immediate care. Priority two, it is yellow. So if you be delay, your patient will not die. Priority three, minimal help they need, they can wait. It is green. And priority four, expectant, they will die, whatever you do. So if you be late or if you give your maximum time, although they will die. So it is expectant and it is black. So immediate, a patient have nosebleed. If you little bit push in the nasal septa, bleeding will stop and patient will be okay. But if you do not put the pressure, bleeding will continue and patient can develop hypotension and shock and will die. Imagine a patient has very bad head injuries, and whatever you do, head injury is so bad and patient will not survive. It is black. Imagine a patient has minor wound injuries, right? Very minor burn, or any small finger is broken, so they can wait, right? They will not die. And yellow means they need your help, but not as immediate like red. So red one, life-threatening injuries or survival with the minimal intervention. So if you help little bit, your patient can survive. And if you do not, your patient will die. So like chest wound, ribs is broken. So if you do not fix it, patient can die. Airway obstruction means if you remove the obstacle, patient will be okay. Shock, it is lead to the death. Need patient fluid replacement. Pneumothorax, second or third degree burns, 15 to 40% body burn. If you give them Ringer's solution, your patient survive. But if the shock is more than 60% in disaster, whatever you give, it is difficult to survive. So the patient who need immediate care, the keyword related to this, they are very anxiety, apprehensions, restlessness, confusion are common. Also, we will check the level of consciousness, right? Also, we will check the intracranial pressure. What are the common signs and symptoms that indicate the cranial pressure is going up? We have to evaluate. The yellow means little bit delay is okay. So may require immediate attention, but can sometimes wait for the hour. Like abdominal wound without evidence of hemorrhage, soft tissue injuries, also genitourinary injuries, eye injuries, central nervous system injuries. Minimal or green treatment is needed in hour to days. The client may be moved away from triage areas. Upper extremity fracture, minor burn, small laceration without significant bleeding, or psychological disturbance. Who is expectant or black? So injuries are intensive or changes of survival are unlikely. Give the comfort, separate from other, but do not abandon. So who is expectant to die or priority poor or black? Like penetrating head injuries or wound, burn is excess, more than 60% of body surface area get involved, or involuntary movement, seizure, vomiting within 24 hours exposed to radi- radiation or head injuries, profound shock with multiple injuries, or if if you check the vital sign and absence the pulse rate, absence the blood pressure, or fixed and dilated pupils, means patient is already gone and time to say goodbye. So this is basically disaster nursing skill or triage. As I told you, triage nurse always require advanced clinical decision making skill.